Good morning, folks. Today is October the 2nd, 2023. Our work session for the Douglas County Board of Commissioners will come to order. Please take the roll for the record.
Yes, sir. District 1, Dobbs, not present. District 2, Kelly Robinson.
Madam Clerk, present.
Vice Chair, District 3, Tarenia Carthen.
Present.
District 4, Mark Alcaraz.
Present.
Chairman Phil Miller.
I'm here. Commissioners, are there any changes that need to be made to the agenda? If none, the agenda stands as approved. As a reminder, each commissioner will have 3 minutes to make remarks and a 2-minute rebuttal. Clerk, do we have any public comment today?
We did not have anyone sign in, Chairman.
Okay. We have a presentation from Judge Barker tomorrow morning recognizing our DUI and drug court. Next on the agenda is the meeting minutes. Commissioners, please review the minutes before tomorrow's meeting. We have some proclamations for tomorrow. Proclamating the month of October 2023 as Breast Cancer Awareness Month in Douglas County. Proclaiming the week of October the 8th through the 14th, 2023 as Fire Prevention Week in Douglas County, and proclaiming the month of October 2023 as Disability Employment Awareness Month in Douglas County. County Administrator, do we have any business to come before the board?
No, sir.
Okay. Brings us to agenda items. Clerk, please begin with the first agenda item.
Yes, sir. Under grants, we have number 7, authorization to accept a Federal Transit Administration grant, GA 2023-030-000, fiscal year 21, section 5307, funds apportioned to Douglas County in the amount of $1,169,481, and fiscal year 21, 5339 funds in the amount of $250,000. Amend the budget and authorize the chairman to sign all related documents pending final legal review. Director Roberts.
Thank you. Good morning. Good morning, Chairman, Commissioners. How y'all doing today?
Good morning.
This grant is Douglas County share of the Atlanta Urbanized Area Formula Grant for public transit. As you may recall, these funds are by right because we have a transit agency and are part of that UZA area. These funds were originally a part of Douglas County's FY17, FY18 allocation. The grant is 80/20 capital reimbursement and 50/50 operating expense reimbursement. The grant includes maintenance reimbursement at 80% because it's capitalized expenses. The grant also includes much needed transit operating software and hardware, including the passenger counters that we've discussed and the automated fare box collection system. And we're bringing those softwares in-house as opposed to the contractor providing the software, as we're responsible to provide that data to FTA even if there is a change with the third-party operator. We've also, another good benefit is that we've been able to use the CARES funding at 100% the last couple of years. And as that funding is wrapping up, we will have this in place for our operations. The documentation and contracts have all been sent to legal for their review and have been approved, and it's be before y'all for approval tomorrow, signature. Chairman, I'm here for any questions.
Are there any questions from the commissioners?
Yes.
Vice Chair. Sorry.
Good morning,
Good morning.
Director Roberts. So 5307 is the funding source, Urbanized Area Formula Grants. Is this the usual amount that we get because of the area
That's correct.
that you're servicing here in the county?
Yes, ma'am.
Okay. And then how do they account for the total cost of the grant? Like breaking it up, the usages of it?
I see. That's a very good question, Vice Chair. And so you guys remember when we went to the DBE portion earlier this year and had the DBE participation approved? Well, those projects that we went out into to outreach to the DBE, those interested parties were included in that. We knew that this is what we're planning on doing, this is the amount of money that we're going to have to do it, and that's what we included, the software and the vehicles and the other items that the APCs, automatic passenger counters, and things of that nature. So we went out and shared that with the DBEs so that we knew what we were going to spend it on, and so we already shared that part. And now we've gone through the process to apply for the funding, and it's now been approved by FTA. And what they do is they approve it, and then they send it to the Department of Labor, and it comes back, and then we bring it before y'all. So we knew exactly what we were going to spend and exactly how much we had allocated to do so.
Got you. And so now these funds have to go through the procurement process in order to be spent?
Yes.
Okay. All right. That is all. I yield. Thank you.
Mr. Robinson?
Thank you, sir.
Good morning.
Good morning. All right, I'll be quick. Again, you mentioned where I was about to go to. So you're going to use the match coming from the ARPA funds or the SPLOST fund? How are you going to make?
That's a good question. I don't have an answer for that one. I think we would have thought that it was coming from the general fund, but I'm not really. Yeah.
Need an answer.
Okay.
Again, 2020 SPLOST. We had transportation that was committed by the public as a category. You got outstanding cash sitting there. Got principal and interest payment, but we're my schedule are in the SPLOST because you're going to drain out that fund balance with these capital projects that are coming down. Not you personally.
Right.
Messaging. Who's aligning all this? Where's the single view that the board needs to be able to make critical capital decisions across the board? I'm going to be consistent till I die about the need to do this. So, all right, you got it. You fine, Ron. We'll make sure you got the answer tomorrow.
I will,
We'll get funding
but
source.
I need to. I appreciate the question. I need to check on something myself because I don't know if we can use that type of funding for match or not. So I need to check on that myself.
Okay, so you got the ARPA money that we've been using to float our operations in light of the COVID. Got it, or
Right,
whatever case.
right.
You've got a fund balance. You've got lost. You know, again, you got a capital transportation fund. We've got about 4 buckets outstanding, but I need to reckon the board needs help in this. We got to work together.
Yes.
So we need staff accordingly to provide the board with a single view so that when we're looking at you, we can help. We're not against it. It's just, well, I need to be in a
Yeah.
resolution. It has to be a resolution. It just can't be sleight of hand. We'll find out where we're going to put it. You can't play that way no more. You got to come correct, not you. But let that go, Ron. All right, we'll move on. Got to keep going. Too early. All right, the second question I got for you is, since we talked about it, they're rolling this out, let's talk about this technology, this software. You and I have been talking about this in committee for a while. We're finally here.
Right.
I heard you make a comment that says we're going to bring this internal, independent of if the board changes provider of services.
That's correct.
Go a little bit deeper about the software. We're talking about
Okay,
collections. That means when I get on, what do you mean by collection?
There's several things. One, the software we used previously, we pay our third-party operators a cost-plus contract, so they're paid to keep the software. And at first they started with QRide, now it's Passio. We were looking at different types of systems, different softwares that we can do to help. It'll exponentially increase what we do out in the field as it applies to getting more people on the bus and looking at what we can do to prohibit like just single runs, bringing more citizens together and grouping them better. There is a component also that I talked to senior services about that does some some tracking for the NTD, National Transit Database, on the back end as well, which would be hugely beneficial. So those are the kind of things that we want to look at. Now, what we are in the place of, we do have the RFP for the third-party operator out. We are going to have to generate an RFP or something like that for software. I know that there's a lot of different options, and what we need to do is look at it not just from a Connect Douglas standpoint, but from aspects I'd like to include what senior services might need for their dispatching and collaborations as well. So that's kind of what we're anxious to see. And it may be a situation where we get these software providers to come to us and give us all the different types of solutions and things that they have. We've had some calls with some of them, and they're very interesting different components they have. Some of them have similar components according to like NTD tracking and things of that nature, but I think this is going to be very helpful for us, and then we would have the software going forward as an agency and a county and not be dependent on to be a third-party provider to provide that information to us. I know that has been what I've uncovered. It's been a real headache the last several years. So we're definitely looking forward to something that we can have the best solution for the citizens.
I'm gonna let that go. My last question, I get three,
Okay.
is, and I got it, we'll come back to that because you got time.
Mhm.
Or get through the process
Sure.
agreeing, and then you'll come back later for how you implement that will. All right, my last thing is, we talked about, we got a proclamation resolution dealing with disability, employment, awareness. Talk to me about, I know we talked about DBE. Talk about the disabled. How do you accommodate them within the workforce, if at all? Is that a criteria for a federal grant?
There certainly is. There's different criteria for different grants. A couple of examples, like I came before y'all, the last time I was here, we got that $75,000 from ARPA to start the pilot program out in the 4th District. But if you look at the way that structure for that grant's worded, is for 65 and older only. So that's going to be, that segment of the population. The rest of our service we've looked at, we have a 3/4 mile ADA around all of the fixed route, which services those individuals that have a disability that come to our program and go through the checkpoint. The gap in between them is the voucher programs, which are open to those that are disabled that live outside of the ADA service area.
Gotcha. I wasn't pushing so much on who's getting the services. It's those who are delivering, like minority contractors or disabled contractors, right? Minority employees versus disabled employees. It's about the awareness. It's just not that the disabled are just I need. No. Disabled provide value. Disabled can sit here and do this with their eyes closed. So it's just that awareness that I wanted to bring awareness to it. So you're good. I know I already knew the answer. Federal, it is, there is consideration should be given. It's a process. So you've answered the question. Thank you, Ron. You had to go first, so appreciate you.
Yeah.
I yield, Mr. Chair.
Thank you. Anyone else? We're required to, what did you say, a 20% match? Is that what you said?
That's correct.
So that's basically 240,000.
50,000. Yeah, it's right here. I was just sharing with Roslyn right before the meeting, and I'll have an answer to the question you asked by the time I get back there and talk to her for a minute. But yes, it is. This is for operating, maintenance, capital, ADA, paratransit, and there's our Atlanta ADA apportionment. So it is. It is included in the materials that we've sent over for legal review, and that information is in there as well.
Yeah, I agree with Mr. Robinson. We need answers as to how we're going to pay for it. You're going to have that information for us.
Sure.
By tomorrow. Okay. Thank you.
Yeah. Thank you.
Any other questions? Clerk.
Number 8 is authorization to accept the ACC BCG Group Health Benefits Program Health Promotion Grant in the amount of $6,000 in 2 increments of $3,000 each with no match, amend the budget, and authorize the chairman to sign all related documents pending final legal review. Danielle
Morning.
Nichols.
Good morning, Mr. Chair, Madam Vice Chair, members of the board. The county is one of 19 members to receive ACCG's Group Health Benefits Program, Health Promotion and Wellness Grant, which is based on our commitment to employee health along with our demonstrated collaboration with other community groups and organizations engaged in health promotion. The amount of the grant is $6,000, $3,000 which we will receive immediately, and the remaining $3,000 will be received in January of 2024. And there is no matching component associated with this grant. Just as another component that I would like to share, we have received this grant for the past several years, so we're continuing the momentum with being awarded the $6,000. And I'm open for any questions you all may have.
Any comments or questions? Vice Chair?
Good morning, Ms. Nichols.
Good morning.
My question to you is what will be done with the $6,000? Have you already earmarked how you will spend it, or is that still being looked at?
It has not been decided yet. I will be conferring with the board along with the county administration to look at the best ways to revamp our current offerings from a health and wellness perspective. So you all would be able to provide input so that we can make certain the funds are directed in a way that best suits the county and our employees.
Yeah, I know this month is Breast Cancer Awareness Month, and we do have employees at the courthouse who are part-time, which means they don't get benefits. So just while I have your ear, I would love for us to look at those part-time employees who may be in need of a mammogram, who just for whatever reason wouldn't take their own $500 and go get one. If we could possibly allocate, with the board's okay, some of those funds for that. That mammogram bus will be here at the courthouse on October 31st, and I would love if some of our part-time employees could partake of that benefit if so needed.
Absolutely. I've actually been in contact with your legislative aide, so we are working collaboratively to come up with options to cover the cost for any part-time employees that pursue obtaining a mammogram on the date of your event.
Wonderful. Thank you. I
You're
yield,
welcome.
Chairman.
Thank you. Anyone else? Commissioner Robinson?
Good morning.
Good morning.
All right, so to dovetail on back up here, benefits program. Got ACG, if I'm not mistaken, we have other healthcare providers that's given us money for health and wellness. I know you've only been here a couple months, so I'm giving room, teeing it up that says, so, Madam Vice Chair's point, what is the overall approach to this? Do you need time to think about this, or do we have some perishability with the current money that we got that we can't take that long? What are your thoughts?
So definitely need some more time to look at how to best utilize those funds. However, with the funds that we have remaining from the grant that we received from Anthem, we are looking to aggressively make certain that our employees can receive the benefit and the impact of those remaining dollars in a way that they probably have not seen over the past couple years.
Yeah, let's be thoughtful about it.
Okay.
Sometimes we've got to look at go back to the service providers. If we outsource things to certain contractors, look for where's the reporting, where's the outcome? What did you really do? So I appreciate your thoughtfulness. Take your time. I know it's perishability and stuff. Glad to hear that we're tightening up how we do these exchanges. We don't mind outsourcing. We don't mind partnering with people in the community, but they got to come correct. There needs to be outcome driven. And I know you know this because you're HR. So thank you for hearing my concern, and I know you got this. Mr. Chair, yo.
Thank you. Anyone else? Clerk?
Yes, number 9 is approval of the 2024 Douglas County Employee Benefit Offerings as recommended by the Benefits Committee, and authorize the chairman to sign all related documents pending final legal review. Danielle Nichols.
Thank you. So the Benefits Committee has reviewed and analyzed our existing health benefits, renewal options, and avenues for cost savings. So at this time, I would like to bring up John Leggett with the county's Benefits Advisor, MSI Benefits Group, who will delve a bit deeper into specifics related to our upcoming renewal.
Thank you. Hey, good morning. John Leggett with MSI Benefits Group. Glad to be here. It's that time of year when we talk about the county's benefits program, and Ms. Danielle said we had our the benefits committee meeting last Monday, and so what I'm presenting today is what was taken from that meeting and as recommended and voted on by the benefits committee. So the current benefit offerings and recommendations that are on the table, of course, the county, you can see current 2023 carrier, and so as you look down the line there, you'll see medical, pharmacy, stop loss. All of that, of course, is what makes up the county's health plan. You'll see the current carrier is Anthem for the TPA, third-party administrator, Veracity and ProCare for pharmacy, and then our stop loss is currently Anthem. Obviously, all of these, everything we're looking at is renewing January 1st. So when you go to the right of that, you'll see what we're recommending as far as 2024. So first thing you'll notice, no change in third-party administrators. We did take a look at independent TPAs and other TPAs this year, and it made the most sense without question to stay with Anthem. We're not making any recommendation or change in pharmacy, so continue that with Veracity and ProCare. But you will notice we are looking to make a change in stop loss, and I'm going to talk more about this, carving out the stop loss coverage, which is currently with Anthem, and taking that to Voya. As you go down, you'll notice vision, Medicare, dental, all of that is going to remain the same. I'll have slides on those. I will say the Medicare Advantage plan is for retirees. We actually negotiated a no change whatsoever in that, so that will stay with Aetna. And then the county has disability, both employer-paid long-term and voluntary short-term. That's through One America. We're making a recommendation to continue that. We are looking to make a change on the life insurance, which is currently with MetLife, and we're going to be making a recommendation to move that over to One America. So you'll see a slide on that. A lot of numbers up here, but this is the medical renewal options. I think when we presented, there were 6 or 7 options. What came out of the meeting was that the committee unanimously recommended, I believe, I say unanimously, was the biggest vote getter was option 2. And option 2 is continuing with Anthem, carving out the stop loss with Voya. Then that projected increase is about 3.2%. The total premium with Voya, so there's 2 things that make up the county's health plan. You have your fixed premium, which you pay for administration when you for Anthem and Voya. The stop loss are, is what makes up the premium, the county's health plan, and then of course there's the claims. The claims are the biggest piece, but what we're looking at is changing to Voya, which is about a $319,000 difference between where Anthem was. So with Anthem, we were looking at an increase in premium about $192,000. With Voya, we're looking at a premium decrease from current of about $126,000. It's about a difference, as I said, about $319,000. And then per our contract, under a self-insured contract like we have here, we have, we have our ceiling, our maximum coverage, and then we have our expected claim liability. So budgeting purposes are always calculated off of the expected claim liability. So as you see, we're continuing with Anthem. We're going to have the Anthem network, continue to use Veracity. So the only change under option 2 is with Voya. So our claims are our claims, but when you come down and you notice on the sheet there, it's small in front of me, our claim liability under option 1 is $14,425,000, and under option 2, it's $14,513,000. Well, realistically, the claims are going to be the claims. That number does come from the contract as presented by Voya, so that's the number we use. But when you come down to the bottom, you'll notice that overall, with Anthem, had we renewed across the board, we were looking at about a $700,000 increase, right at 5%, versus a $473,000 increase at 3.2% by carving out with Voya. Some of the things that are included with the carve-out with Voya, this is actually going to be administered through Strategic Benefit Resources, they're in SBR, which is going to be managing the stop loss. And so every year when we are looking at renewal, they go to market and they have about 20 different carriers they go to. And when we present, we'll have your renewal like we always do, and we may have 2 or 3 different other carriers. Whereas the past several years, we've been with Anthem across the board. We carved out the pharmacy a couple years ago, and that's done well. And now we're looking to carve out the stop loss because we think we can do a lot more in helping the county reduce costs there and maintain premium by doing that. And so the contract additionally does have what's called a no new laser. Right now, the county has a $175,000 $175,000 deductible on every single individual because the county is self-insured. So all claims are paid up to that $175,000. There are no lasers under our plan right now, and a laser is everybody's $175,000 except that individual there. We know they're going to have claims. We're going to make that person $250,000. And so they laser an individual, and the county has to pay the claims up to that total. So currently, we do not have a laser. We do see those occasionally, but the Voya contract has a no new laser provision, so no matter what, there'll be no new lasers next year. There's also a rate cap under the plan. Anthem is going to continue to give the county $75,000 in wellness money, so that is there. There are no recommended changes to the health plan or to deductions. So from an employee standpoint, Voya is a behind-the-scenes kind of benefit. It really has no impact on employees' benefits. They're going to still have their Anthem card and get their coverage through the POS HMO network, and they will continue to use Veracity and ProCare for their pharmacy. So I'll stop there, but just wanted to kind of go over that with you. Any questions?
Commissioners, any questions? Comments? Mr. Robinson?
All right. You said a lot.
I did.
All right. So you have to pay attention. All right, let's see if I got this right. So I appreciate you guys' approach to sort of trying to normalize and take the volatility out of claims insurance. I get it. I get the carve-outs. I get the formula. What do you call it? The formula. About 3 or 4 years ago, we did that regarding pharmaceuticals. We're looking at that. Now I hear what you're doing. Stop loss. I get it. I get we're self-assured. Here's that. Like, and I'm watching these expenses go up. I've been here 15 years. Imagine I've seen this thing grow from probably what? What'd you say? 14 million?
Overall, the budget number would be about just over 15 million.
15 million. Look at that. Look at that multiple. Lord, I get it. I'm giving context. This is history for
Sure.
my peers. So look at that growth, and you got to pay that off the top, guys. You got to pay this. Well, here's my thing. As you guys are in there, and I appreciate my committee. You guys are on that. The benefits that you took a look at this and you came with your recommendation. Here's what I'm looking for. It's about outcome. When we carve things out, when we go with these, we break it up and give other service providers. While you may save me money, do I get my same experience? Service delivery. Right? You save me money, but if my service delivery goes down, that's an issue. Think about it, guys. So I got it cheaper, but I'm paying for the cheaper. It's just a relative statement. I'm not.
Sure.
So how do you address complaints that may exist regarding service delivery? Let's use pharmaceuticals for a minute. How do you evaluate those service providers along the supply chain to ensure that we got what we were looking for, even though we're saving? It's like, okay, but it's the experience. Talk to me. I know you're aware of this. Please talk to me.
So when it comes to the pharmacy, obviously I think it was 2 years ago when we carved out took it from Anthem and moved it over to ProCare and Veracity. And I think the very first year we saw nearly $1.9 million in reduced costs and claims just from doing that. And so whenever there's change like that, whenever you see, we're going from what we've been doing forever to a new program that's going to save $1.9 million, there's going to be some disruption. We know that's the case. There are different ways to cover certain medications. There's programs and foundations, and so it takes, it took a couple, 2-3 months to get some of the folks that were taking the high-cost drugs into those programs, and obviously you can see the outcomes. What we've seen is when we come back for year 2 and we do the open enrollment, the overall support and from the employees and how happy they've been with the program is overwhelming. Because you have employees that are taking these high-cost medications and now all of a sudden they're getting mailed to them, their house, no cost. They're not paying anything and they're coming in every month. So yes, I think at this point we have about 15 different governments we've moved over to this program, and there's always a little bit of noise in the beginning. But to date, I believe the program seems to be running well. There's probably a hiccup here and there. But as far as customer service issues and anytime there's a problem, the good news is Veracity and ProCare are both local. So whenever there's any issue, their customer service is on it. They jump on it immediately. And of course, employees that do have issues will be able to come in during open enrollment and talk to us, and we can have direct access to Veracity reps. Hopefully helps you understand. As far as the changes this year, there'll be no service impact whatsoever because, again, the stop loss, which is really the only thing we're looking to change, is a behind-the-scenes benefit. It's where the county has protection under the health plan.
And Commissioner Robinson, and for the board's awareness, more specifically, we did encounter a situation where there were some issues with the pharmacy and receiving information specifically related to specialty pharmaceuticals after hours. We have identified that issue is specifically related to communication, meaning there is a special protocol associated with after hours responses from a customer service perspective. So MSI has worked diligently with Veracity to make certain that we rectify that and update the communication so that all employees are aware of who they need to contact after hours, meaning after 5 p.m., and more specifically, understanding that there will not be information that is available during the after-hour window, but it will be available immediately the next morning.
Thank you for that. Thank you. That was a concern. I'm not only do I advocate for obviously my citizens, constituents, but also employees. And since we are in Breast Cancer Month awareness, is something like I'll use myself. If I can't get my medicine, that's an issue. Like if you're going to take 15 million out of me, you telling me I don't have any workflow process for communication. We're not worth that to make this smooth. After hours, why does it matter? It should automatically roll over like Comcast, anybody else after hours. It's about that experience. I'm paying 15 off the top. And you got people who got, wait a minute, I got to do what? I got to do what? I got to jump through what? It should be seamless. That's too much money. It's about that experience. I grew up in Prudential just by way, so there's something like, no, I know how it works on the inside. It's that extra step of care. While we may save some money to my peers, hold these vendors accountable, but it's like, okay, but are we getting our outcome and experience? Don't tell me my experience. Can't tell me what my experience is. I'm sharing with you. All right, thank you. I got to yield. Thank you, guys. I yield.
Thank you. Anyone else? Commissioner, Vice Chair Carter.
This question may be for Director Nichols. Who is on the benefits committee?
Yes, Madam Vice Chair, we have Mr. Chair Miller, that is the lead of the committee. The Vice Chair of that committee is Commissioner Alcaraz. Then you have representation from HR, which is myself, from Finance, which is Rosalind Miller, and then we have representation from the Sheriff's Department and the Fire Department.
Okay, so we're looking at 5 or 6 individuals on the committee
That's correct.
that actually took a look at this.
Yes.
Okay.
And then we also have the committee open, so other departments, if they want to send a representative to participate in the meeting, they can also do that as well.
Okay, so that's good to know for the public. And then my second question is, between what we spent last year and what is projected to be spent in 2024, what is that difference?
So if you notice under current would be the projected spend for 2023, which is 14,632 in the yellow. And then if you go to the right of that under option 2, what we're recommending, it's 15,105. So it's about that's where the increase of 473,000 comes in. That is the fixed premium that's paid for the plan and the expected claim liability combined.
And where are you getting that number from?
It's directly from the proposal, from the contract. So when you're self-insured, you're paying for aggregate protection, the ceiling. And generally speaking, the expected claim liability is 80% of that, which is what most self-insured employers budget off of. So the contract has the max liability, and 80% of that is how you calculate the number. This is how it's always been done, even under with Anthem, and even by moving to Voya, it would be done the same way.
Got you. And back to Commissioner Robinson's experience with pharmacy. Do you all like audit the pharmacy benefit or third party that you use? Because I know I even had some issues with it. So that pharmacy benefit piece is a little iffy with us. If it's just us on the Board of Commissioners, I can imagine what some of the employees may have gone through. And so if somebody, is released out of the hospital at 3:00 in the morning and they want to get their medication, they shouldn't have to wait until the next day to receive their medication. There should always be someone on call. That may be something that you all want to look at, because I don't want an employee to have to wait until 7 or 8 o'clock when that office opens to get the approval for that medication to go through. That's just, to me, unacceptable.
I agree. There actually is an after-hours flyer that we had Veracity put together. I believe we
Okay.
sent that over. And so we'll be promoting that when we get through open enrollment, so everyone does know.
Okay.
I don't recall, but even with Anthem, I'm not sure how reliable it was to try to get someone after hours, even on the pharmacy piece. But they do have a number, and we do have that flyer out there to one page, so we can make sure everyone knows. As far as auditing, I mean, we try to be an extension, right, for the county and between the brokers, between the insurance companies. So employees are constantly calling us, and we get involved. And whenever there are issues, hopefully we hear about it. And that is the one thing I will say about Veracity. Their customer service is top notch. We worked with them for about 3 years. When there's a problem, they're on it. So if we don't hear about it, unfortunately, there's just no way. So we do need to make sure the employees know about the after hours number, and if they ever have any issues, to call us for sure, which we try to promote that during open enrollment.
But John, you do know I'm looking at you, because I'm going to go straight to you.
Oh, yeah. Well,
Because
you know
you're
where
the
I'm at.
conduit, right? Because we got some admin fees in here that you all collect. So we are.
Absolutely.
We're looking at you.
That is our role. Absolutely. No,
All
we
right.
want employees to call us, and we got involved even, this current year when we were moving everyone over to the personal importation. There were folks out there, they were on medications that were eligible to get them through that program at no cost. And here's the list. And we're reaching out to them and making sure everybody enrolls and get everybody enrolled, because there's huge savings to the county for doing that. No, we're highly involved. That's our role. That's what makes us unique
All right.
to a lot of brokers.
Thank you. Chairman, I yield.
Anyone else? Commissioner Robinson?
All right, so, no, but to that point, again, I want y'all to my peers, think through when we make these trade-offs. Again, so you've got an international company. We took some public grief on that by moving this outside the county. I'm good at history. Outside this country that says, okay, we can get savings by going international. Oh boy, that argument. I get it, it brings money. It may get savings, it may be cheaper, but I'm back to the service. I'm back to no, a flyer is not going to be are you serious? I don't do nothing. My doctor calls it in. So why does me as an employee, so if you're going to do a decision tree, do both employees and doctor. That's branching. So my doctor calls, there's no 800 number don't work. The fax don't work. Are you kidding me? You can't discount this. To her point, you need to feel this. Don't marginalize us in this conversation. No, we're not playing with this. We're talking about people who need their medication. And one of my veterans that need something, no, we're serious about this. I get the savings, but if I don't have the experience, the outcome, a person can't get their medication. Are you kidding me? I'm saying we paying $14 million off the top. The savings you get, I'd rather left it as it was. At least it worked. I went that long, a decade without a problem. And I get disruption, but I need you to acknowledge you got to hear us. That's all. I'm sure you'll work through this. I'm hopeful. We got a new, obviously, HR director. You guys will work through this, but we're serious. Do you hear us? Don't tell us what our experience is. Don't tell us that it's normal. Don't normalize a bad experience. Don't do that. It's do you hear me? That we're paying a premium for this, and we need this to be addressed. And listen to what I just told you. You keep talking about the employees. Well, I got to go do everybody else's job. What about Think about it. Why we gotta do all that? What are you here for? All right, you got my point. I'll stop. There, the buzzer. Thank you, Mr. Chair.
Anyone else? I have a question. Paul Bates evidently told a employee that there's been changes in insurance for our retirees. Is there anything to that?
Paul Bates with ACCG. Yep.
Yes, are you aware of any changes as far as our retiree insurance is concerned, or our future retirees?
Mr. Chair, I'm not aware of such a change, but I can definitely reach out to Mr. Bates and find
Would you
out what
please,
that conversation could have been.
He raised a question in some meeting recently that the insurance, that newer employees that are hired, either we're not going to have retiree insurance, or that it had been changed to some degree. And if you'd find that out for me, I'd appreciate it.
Absolutely, I'll get that information back to you expeditiously.
Thank you. Anyone else? Next.
Number 10, we have authorization to enter into a memorandum of agreement between Douglas County Fire and EMS Department and Right Side Health, Inc. for non-emergency telehealth services at no cost to the county, and authorize the chairman to sign all related documents pending final legal review. Chief Allen, or Farmer.
Good morning, Chair, Vice
Morning.
Chair, Board. Basically, what this is Right Side is a agency that partners with the Douglas County Fire and EMS, and it bridges, it links the non-emergent patient with telehealth medicine. To go in more detail with this, I'm gonna have Division Chief Farmer, our EMS chief, to talk more in depth.
Morning. We have a real quick presentation. So Right Side was founded in 2020. They've been providing telehealth services to counties and cities since that time. And they work very similar to our Live Health. So they'll connect patients with non-emergency needs to a telehealth physician or to services that are going to be the most appropriate place for them to get the health care that they need. We've been working on telehealth since 2022. It was included in our EMS strategic plan. And the goal is to reduce avoidable ER admissions. Let me skip for 1 second here. I kind of want to start on this slide here with the need. We have a lot of patients in our community that are on fixed income, or patients that will call 911 for emergency, non-emergency needs that need access to care, but it may not necessarily be an emergency room. And so by integrating with telehealth, it's going to give us an opportunity to serve that part of our community. It is going to decrease unnecessary ER trips and fees for those individuals. One of the things that we put up here too is just overall from our system of care. One of the things that we run into is our wall times, which is how long it takes to turn over patients to an emergency room once we get on scene. We'll have, for example, last month we had almost 500 times where it took us more than 30 minutes to turn over our patients, more than 100 events where it took us more than an hour to turn our patients over to an emergency room. And so what we have is events that occur where our ambulances are tied up on the walls of hospitals and aren't able to turn those patients over. And so it impacts our system of care. So telehealth is going to be key for several different things, one being the patients that we serve and another for being our overall 911 system. And then let me go back. I wanted to give just kind of an overview of what this looks like. So telehealth has 2 points of entry into the system. Number one is actually through the 911 system, which I have Ms. Katrina Hartley here as well. And so, for example, a patient that has a non-emergency need would call 911, and then based on that nature code, if the patients are willing, they would be sent to a telehealth service instead of getting an ambulance. For patients that want the ambulance, they can still have the ambulance sent to that scene. And from that point, the paramedics or the AEMTs that are on those bed units could then take and reach out to telehealth services once they've done a hands-on assessment with those patients, if telehealth is the most appropriate means for that patient. And so there's two different points of entry. What we are anticipating on our end, looking at our actual numbers, is this diverting approximately 25% or 11 patients a day from unnecessary ER visits. And so that's the impact that it could have on our community and on our service. So that is a real quick overview of Right Site.
Any questions from commissioners? Vice Chair.
So, thank you all, right? Because I've heard so many of the stories sitting on the Public Safety Committee about how many times you all have had to sit on the wall at the hospital because you can't just drop the patient off. The patient has to actually be handed to somebody at the ER so that the patient can be properly seen. But that, again, takes up your time from going and handling other calls. So I think this is a step definitely in the right direction with Right Side. So you're saying that when they call in to E911, they will get Director Hartley's office, and then from there, they will be able to triage whether or not they are to send for you, or they can go through Right Site for telehealth.
Yep, and that's based on our medical director's recommendations, just like he does now.
Okay, so the medical director is sitting there inside the office, and so he or she knows.
Well, they do it based on nature code, so whatever the
Okay.
caller calls in for, they'll go through and EMD that call,
Uh-huh.
and then the EMD will tell, just like it now it says if we respond emergency or non-emergency, now there'll be another tier to dispatch telehealth.
And so my other question to that then, and I know you're getting ready to expound upon that, but my other question is timing, right? How will that impact timing is where I was really going.
And so emergency medical, EMD is emergency medical dispatch. So when someone calls into 911, we use a protocol that determines based on what that patient or the caller says regarding that patient's level of care or whatever is the chief complaint. And so with many of those calls will still be dispatched like they would normally be dispatched. And a lot of times, fire EMS will still be dispatched out to those calls. At that point, that is when Right Site will be called to implement that telehealth piece prior to transport.
Okay, got you. And so that patient will have access to it through their phone or through some type of personal device.
Yes.
Got you. And so it won't impact timing.
Well, and timing is kind of one of those things that we do need to reevaluate with our ordinance at some point. We were actually looking over that too. Our ordinance for EMS is from 1984. And so the timing piece is really key for your emergency time from dispatch to arrival on scene for your emergencies. But in today's, use of 911 service, a lot of those calls are non-emergency. And so it does kind of change the benefit to risk to the community when you're driving emergency for those non-emergency calls. So I don't want to say that it wouldn't change the timing at all, but it definitely would not impact the emergency response time.
Fair enough.
One thing that it will certainly impact is for those citizens and patients that maybe have chronic things going on where they may not actually know who to call, so they call 911. And so by having access to Right Site, it will be able to facilitate a more efficient response for them anytime a chronic emergency comes up.
Thank you. I yield, Chairman.
Anyone else? Commissioner Alcaraz.
I see this not only a benefit to the department, but also to our local hospital, because if we're not transporting 25% of the patients from your department to the hospital, that frees them up in regards to doctors and care for our community and our citizens at the hospital. So that patients who actually are driven themselves or having some issues there, it'll help our hospital get to them quicker. I do want to sit down and talk with you about this ordinance. That it does seem a little outdated, but I do want to take that offline, and I will have a conversation about that here real soon. I yield, Chairman.
Anyone else? Next.
Number 11, approval of a 12-month contract with Owen Security System to provide security for the Board of Elections annex locations located at 6381 Catherine Street, Suite B and Suite D, with a one-time upfront fee of $199 and monthly fees of $39.99 and $36.99 for a monthly total of $76.98 to be funded through the Elections Department budget, and authorize the chairman to sign all related documents pending final legal review. Milton Kidd.
Good afternoon, Chairman, Vice Chair, and to the Commissioners. This is a contract of service for a company that will be replacing our current servicer. This is the company, basically the security system for our annex location. After review of the current company, we were not satisfied with the service delivery of the current vendor, so we're essentially switching vendors and asking this board to approve this switch. This is an item that is currently budgeted in our current year's budget, as well as for our future year's budget as well.
Okay, any questions, comments? Thank you, sir.
Number 12, certificate of preliminary plat approval for Walters Creek subdivision. Bill Schaefer is here.
Morning.
Morning, Mr. Chairman. So we have a small subdivision on West Stewart Mill. This is the Walters Creek subdivision on 22 acres at 5010 Stewart Mill Road. The applicant's requesting approval for the preliminary plat for the subdivision. It's going to create 41 lots on 15,000 square feet each, with accompanying play area and open space for the people who live there. The site is going to be served by public water and sewer. The proposed density is 1.84 units an acre. The permissible density is 2.29 units an acre. The DRC reviewed the project and authorized approval on September 5th, which we're bringing to you with a recommendation that you authorize the certificate of preliminary plat approval and accept in principle all right-of-way dedications as shown and required under the UDC, and allow the chair to sign all documents related thereto pending legal review as necessary.
Comments? Questions? Commissioner Alcaraz.
Mr. Schaefer, can you give me that address one more time, please?
5010 Stewart Mill.
All I need, Chairman. Thank you.
Commissioner Robinson.
Good morning, Phil. How are you?
Morning.
All right, real quick question. This is broader. So this is a new community, and does it have neighbors? Is there anything around it? Help me.
The city is around it.
City of Douglasville?
Correct.
So when it comes to communication, I've got an experience where something, if it's already zoned properly, the board may not see anything about it, it'll just go. And citizens may say, okay, where'd this come from? And it could be compatible. I'm not talking about non-compatible. I'm talking about compatible. And when that happens, the communication, how do we assure that, okay, we got this neighbor that's moving in, while this may be a smaller community than what I'm thinking, maybe 500 units versus 50 units. It's all relative to me. Is there a way, some kind of way that we can get this on the docket in a future zoning meeting to ensure, to revisit communications and our processes for that?
If you wish, absolutely. Absolutely. As you point out, this is one of those that is a by right, and of course, when we looked at the property in DRC, we kind of chopped it down a little bit because you do have the ability to make it more dense, but there's some environmental issues, there's some stream setbacks, and there's some open space requirements, so rather than the maximum permissible density, they're only getting 1.84 units an acre, not the 2.23 that they could have gotten. But that's again the DRC. But in order for you to see them again as a public hearing, there's no rezoning process involved. It's literally just a subdivision diagram design approval process at this point. But don't make the mistake of thinking you don't have the right to say no. This is a vote of the Board of Commissioners. If you don't like the design or you feel that something is not appropriate that you would like to address, you have the right to say, Phil, fix this. And we would bring it back to the developer and say, the board has disapproved this with the following condition, that we work with you to redesign.
I really always appreciate your articulation. I got it. And this is broader for my peers. I got it. I know the value of saying no. I get it. But you hear me. I won't belabor this. I'll trust home rule if you guys want this design. That wasn't my issue. It's more about the communication, the broader need to say, okay, guys, let's make sure we get this right. That when other people come into the community of compatible value, whether it's apartments, townhomes, single family, if they can just pop in there by right, and people look up like, okay, where did this come from? They'll look to the Board of Commissioners and like, okay, haven't you been paying attention to notices? And says, but staff tells me, well, you didn't need notices. Ooh, you could drop down that many people on next somebody and not even give courtesy, and not that you could have stopped it by right. It's just the courtesy.
Mm-hmm.
It's the environmental, the deer, the snakes to get moved, the impact. It's like, okay, come on. So it's up to the board, like, no, I get it, but you still should let them know. Let the neighbors know that somebody's going to move in like that. That's something the board, we need to debate. I've already talked to, obviously, Allison Duncan, manager. I'm sure you're aware. Let's take this offline and let's make sure we revisit this at a later time, okay?
Yes, sir.
That's all I needed. Thank you, Mr. Chair.
Anyone else? Vice Chair.
Good morning, Mr. Schaefer. So tell me again, how many homes are we looking at?
41.
41, and the average home site?
The lot size will be 15,000 because 15,000 square feet is allowed when you're on sewer. Otherwise, it would be 33,000 square feet.
Okay. And so this particular contractor, I won't say the name, although you have said the name, I have gotten several complaints for. And I do mean several. I'm looking at my emails right now. What district is this going into?
I believe it's your district.
It's my district.
Yeah.
I need you to talk to me offline before we say, before I vote for this. And I'll leave it at that. Thank you. I yield, Chairman.
Anyone else? Commissioner Alcaraz.
Mr. Schaefer, can you email all of us that plat layout so we can see that?
It's in your package.
It's in my package?
Yeah,
Okay, perfect.
it's a file in your package.
I yield, Chairman.
Commissioner Robinson.
One more. All right, so again, I'm on that notion right now. So just make a note of this, Phil. So explain, so if in fact we don't, as a board, approve or work with developers to a certain extent, they go to the city annexes them. Now, and I got this challenge on Riverside, like, okay, wait a minute, so I got to pay for the infrastructure, but we allowed them to be annexed, and so they get the tax dollars, but I got to pay for the infrastructure, for that density. There is a trade-off to my peers. So balance how you look at stuff. Don't be so absolute. It's a trade-off. That's why I asked the question, what's around? He said city. You're going to give that tax dollars, you're going to take that density, and you got to pay for that. Pay attention. All right, thank you. I just want to make that comment as well. Phil, I know you got this.
Yes, sir.
Anyone else? Next.
Number 13, approval of a contract with ROK Technology for GIS cloud hosting services in the amount of $95,670 to be funded through the previously approved 2022 ARPA technology projects as recommended by the Technology Committee, and authorize the chairman to sign all related documents pending final legal review. Alex Bettencourt.
Good morning, Chairman
Morning.
and Vice Chair. This is a project that was approved last year by the BOC. There is a service contract and a hosting contract attached to it. This project is to move all our GIS operations to a cloud service. where it would allow the GIS department more resources and more availability for their software. Their services are in high demand right now from almost every department between data and tax purposes and plotting reasons. So we're moving all of their operations online. So this service contract has to be signed and approved by the board. Legal has already signed off on it, and so we're bringing it to you today.
Any questions? Vice Chair?
Director Bentoncourt, I just have one question for you. Ed Dean is aware of this, correct?
Yes, this is his project.
Okay. And is there a monthly fee, or will this encompass the whole?
It's a yearly fee that's already been allocated in the budget.
That's already been allocated in the budget. Okay, you knew where I was going. Thank you. I yield.
Anyone else? Thank you, sir.
Thank you.
Next, Madam Clerk.
Number 14 is authorization to approve the 2024 schedule for work sessions, commission meetings, planning and zoning board meetings, and variance hearings. This would be an I placed on the agenda. Let me pull it up here. So it's based on our normal scheduling for the commission meetings and work sessions, with just a few changes due to holidays. The both of the January meetings have been shifted due to New Year's Day holiday and the MLK holiday. The July meetings were moved to the second and fourth week due to Independence Day holiday. And then the first meeting in September was moved to Wednesday and Thursday due to Labor Day holiday. And the last one was the first meetings in November were moved up a week due to election week. But that would be the only changes from our normal schedule.
Okay. Questions or comments? Vice Chair.
So, Ms. Watson, our first meeting in January will be January 8th?
Yes, ma'am.
That is a good break. And the following, and so planning and zoning, I'm assuming aligns.
Yes.
So they know this.
They are following with
okay.
our schedule.
All right. That was my question. That was my next question. All right. I yield, Chairman.
Anyone else? Thank you. Do we have any commissioner comments? Commissioner Robinson.
Yeah, just one, just as a reminder, and to the public, and more importantly, the county clerk and the county attorney has said, legislation that we plan to propose this year, I will have at least my set in fully by next meeting so that we can meet and align with the budget adoption process. So anybody else who's going to put things forth, and I would encourage the administration, if they're going to bring something forth, let's line this all up so that we can have one fell swoop and give obviously the county clerk time to promote this in the legal organ, whether it's an ordinance or a policy accordingly. So again, I'm thinking that by next meeting, anything that's going to be drafted and considered by the board, we got to hit this target. But to that point, county clerk, when is the last meeting? When is the meeting that's supposed to be adopted by the board, the budget? We talked about this last week. What's that date? November? Take your time. It's important. I wanted a record.
I have that scheduled for November 14th.
November 14th. So we're talking about less than 30 days. That means what, 2 meetings from now? We got 2. Is that enough time for you to put legislation, both or either an ordinance or policy in legal organ? You got enough time to advertise?
Yeah, we would need at least 2 to advertise before any public hearings.
Before any public hearings. Then how many public hearings do we have to do for an ordinance?
Just one.
Just the day of. We can have the hearing and adopt it on the same day.
Correct.
All right. So, yeah, by our next meeting. Got it. That's what I need. I just wanted to have that for the record. Mr. Chair, you up there. Thank you.
Okay. Mr. Coleman, do we need to go into executive session?
Mr. Chairman, we do need to go into executive session to discuss personnel and real estate matters.
Okay.
Chairman Miller, I move that we go into executive session for personnel and real estate matters.
Second.
We have a motion and a second. All in favor? Same sign. If you're opposed, it passes. Thank you. Need to,
We'll need to adjourn the work session.
this meeting is adjourned.